Welcome to our video series on Sjogren's disease, where we look beyond dryness to the full impact of this complex condition. In each episode, my colleagues and I share our insights to help fellow healthcare professionals recognize and manage Sjogren's disease with clarity and confidence. In this video, we examine Sjogren's disease as more than Sicca symptoms, highlighting its systemic involvement, patient variability, and the importance of early recognition. Hi, my name is Dr. Teja Kapoor. I'm a rheumatologist and director of the Columbia Sjogren Center in New York City. I am joined by my colleagues today to discuss Sjogren's disease, a condition we each have extensive experience managing in our own practices.
Hello, I'm Dr. Adam Doré, a rheumatologist at Allegheny Health Network in Pittsburgh, Pennsylvania, and I'm happy to be here.
And I'm Erin Siceloff, a physician assistant specializing in rheumatology, including Sjogren's disease at AOCC in Charlotte, North Carolina. Thank you for having me.
Dr. Doré, will you start us off?
You may already be familiar with how Sjogren's disease is typically characterized. Sjogren's disease often features Sicca symptoms, such as dry mouth or xerostomia, and ocular dryness or keratoconjunctivitis. But it's important to recognize that Sjogren's disease may extend far beyond dryness. It is a serious systemic autoimmune disease that can be progressive and affect multiple organs, including the joints, skin, and more. As you may know, Sjogren's disease affects up to 4 million people in the US, with a prevalence between 0.5% and 1% of the population. It predominantly affects women, with a female-to-male ratio of 9:1, and symptoms usually begin to appear between the ages of 45 and 55 years. We've talked about the prevalence, but statistics are only one part of the story. Erin, can you walk us through the manifestations patients may experience?
Of course. Looking at these data, it's clear that patients carry a large symptom burden. This comes from the Living with Sjogren's patient survey conducted by the Harris Poll on behalf of the Sjogren's Foundation. The survey questioned adult patients with Sjogren's about the variety and severity of the symptoms that they had experienced in the last 12 months. It included 3,622 self-reported respondents not verified by a physician, 97% of whom were female, with an average age at diagnosis of 49.7 years. While it's no surprise that dryness symptoms are at the top, there are many more symptoms that patients may experience. In fact, 36 symptoms were experienced by 30% or more of patients, and 21 symptoms were experienced by more than half of patients in the past 12 months. As I mentioned, these findings highlight the breadth of symptoms and burden endured by patients with Sjogren's. Here are a few examples of how patients may present when they first come to a rheumatologist's office. Dr. Kapoor, does this reflect what you typically see in your own practice when patients first come to see you?
Absolutely. From what I've seen in my practice, no two patients present with the same manifestations. These represent typical clinical presentations observed at a patient's initial rheumatology consult. While some experience classic Sicca symptoms, others show significant systemic involvement, ranging from joint inflammation to neuropathy and vasculitis. And this variability underscores the importance of a comprehensive, individualized approach to evaluation and management, looking beyond dryness to identify systemic disease and inform appropriate therapy. Let's look at a couple of examples. Emma is experiencing severe Sicca and fatigue complaints, but has no obvious systemic involvement. In contrast, patients like Rebecca report mild dry eyes, reminding us that dryness is not always the chief symptom. Dryness symptoms are one of the top reasons my patients seek care. And while most patients with Sjogren's disease experience dry mouth and eyes, early detection of Sjogren's can be challenging due to the high prevalence of other conditions that can also cause dryness. That's why asking targeted screening questions is critical, since patients often underestimate or adapt to their symptoms.
That's a great point. When I see a patient who may meet the criteria for Sjogren's disease but doesn't report Sicca symptoms, I ask specific questions to assess for subjective dryness. Conversely, when patients report dryness, it's crucial to evaluate whether these symptoms are related to Sjogren's. Some of these questions include, is your mouth dry when eating a meal? Can you eat a cracker without drinking a fluid or liquid? How often do you have excessive tearing? Are you able to produce tears?
To build upon that, I've found that these few questions can reveal both oral and ocular dryness that patients might not mention otherwise, or they may have normalized over time. The questions are quick to ask during a visit and can serve as an early signal that further evaluation for Sjögren's may be warranted, especially when dryness is accompanied by fatigue, pain, or systemic signs. This review reminds us that every patient's experience with Sjögren's is unique, making it vital to look beyond dryness and recognize the broader impact of the disease. That's all for this video. Thank you for joining us, and we invite you to explore the other videos. Look beyond dryness and explore the full spectrum of Sjögren's disease at Sjögren'sShoutsHCP.com.